Hello and welcome to this talk on antimicrobial stewardship. Let me first explain to you what is antimicrobial stewardship. We have been used to talking about antibiotic stewardship, but infections can be caused by bacteria, by fungi and viruses. So this broad term antimicrobial stewardship is nowadays being used to encompass all the infections. Now, sepsis is the biggest killer of mankind at the present moment. About 50 million people in the world are dying every year from sepsis. This is a bigger killer than cancer, heart attack and strokes taken together. WHO has declared that infection due to multi-drug resistant organism is going to be the biggest threat to mankind in the coming years. So in this background, the importance of antibiotic and antimicrobial stewardship has become very, very important. Now, bacteria are getting increasingly resistant, more so in the Asian subcontinent. There is a high prevalence of extended spectrum beta lactamases in our country, both in the hospital and in the community. About 60 to 70% of the gram-negative Enterobacteriaceae have become beta lactamase positive. Not only that, there is increasing prevalence of carbapenem resistant Acinetobacter, methicillin resistant Staph aureus and multi-drug resistant Pseudomonas. Deaths are increasingly more due to drug resistant bacteria. Asian continent has been affected mostly by this increasing resistant bacteria. And there are a lot of collateral damage of this infection. There might not be possible to do transplant surgery, chemotherapy, high risk surgery. People are living more nowadays with renal failure and liver failure, and once they get an infection with this drug resistant organism, it will be very difficult for them to survive. So one can imagine the long lasting problems with these kind of infections. On the other hand, the antibiotic pipeline is drying out, especially for gram-negative infection. There hardly been any new class of antibiotic discovered in the last 5 to 6 years against the gram-negative organism. In this background, a review of antibiotic prescription in the hospital by Cochrane collaboration has surmised that about 50% of antibiotic usage in the hospital